Good morning and welcome to COVID-19 Talk with Local Health Authorities. With me is Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County. I am Stephen Williams, Director of the Houston Health Department. I want to thank you to the Rotary Club of Houston and past President Kathy Finninger for actually providing questions for us today. First one's kind of long. The CDC has updated its guidance concerning close contact. Some states have already been following this different definition. They now say someone who was within 6 feet for an infected person for a cumulative non-consecutive total of 15 minutes or more over a 24-hour period starting from 2 days before illness onset or for asymptomatic patients 2 days prior to test specimen collection until the time the patient is isolated. I'm just going to get to the punchline. So if I'm exposed for 5 minutes a day for 3 days, is that close contact? Please elaborate on ramifications and what we need to do.
So good morning. First of all, so they said 5 minutes for 3 days. That's actually not. It's within 24 hours. So let's say it was 5 minutes at a time for 3 different chunks, but within the 24-hour time frame. According to that guidance, then yes, that would be somebody that would be in the mix for testing. Or exposure and testing.
And
what's that?
And
quarantine.
Yeah.
And quarantine. And I'm going to let you talk about the quarantine piece because I think it's a critical one. But what I would say is that, you know, this is the guidance the CDC has given. We don't have we have some information about what the behind-the-scenes rationale was for it. But what we've done, and I know that you all at Houston Health have been doing similar, is to use this as a guide for our epidemiologists as they then interview people, talk to them about exposure. And it allows for when we know it's black or white, we know yes or no, but when it's gray, this gives us some nuances that they can then do some additional interviewing skills to try to determine risk.
Right, right. And then the other thing just to reinforce is that if you are a contact of a known case, you then need to quarantine. And so whichever version of the rule you want to interpret, you still need a quarantine. And if you decide to get tested during that period, during your 14-day quarantine period, a couple of things. First, you don't recommend you get tested within the first 5 days because there's a really high chance of a false negative. And even beyond day 5, there's still a chance of a false negative should you actually be infected. But the only reason to do that is then find out who else needs to be quarantined. So if you, for example, you thought you may have gotten exposed at work, so you go enter quarantine, and you quarantine yourself at home, and then on day 6 or 7 you get yourself tested. It turns out you're positive, which means you get infected whenever at some point, whatever you thought, or maybe some other time. Now you know that probably the rest of your family needs a quarantine as well. That's the purpose of the testing. It's not to get out of quarantine, and that's I think that needs to be important. Testing negative during quarantine does not end your quarantine.
That's right. That's right.
Great insights. An article from the Society for Human Resource Management suggested that we should revise our policies and consider obtaining waivers from those infected so you can share the diagnosis to others in your office without violating their privacy. Is this the only way to accurately do contact tracing?
I don't think
Not sure I fully understand.
Basically, they're saying that if you disclose who was positive in your environment, is that a better way to do would that be an added value to contact tracing?
Well, it's only to the degree where people who are positive would then share that with somebody who could act on it or should act on it.
That's right.
So if people test positive and they don't tell anyone, then there's a delay between when that person tests positive and when it gets to the epidemiologist, right?
That's right.
And so the advantage is that if you share that information, then we can start the contact tracing faster. I would think that would be
I was going to say a very similar thing, that the advantage is that, so if the 3 of us, let's say I'm positive and the 2 of you are unaware, then you aren't going to be able to take appropriate steps. But if I'm positive and I tell you I'm positive, now you 2 can do things while we're still waiting for the quarantine, while we're still waiting for the health department to get the lab results and all that, and contact me, and then I can share the 2 of you. But in the meantime, you're already taking the proactive steps, like quarantine and certainly testing as appropriate as well. So that's where it helps if I give that information. So I would say yes, that is helpful.
So if you give it to me, and let's say we get this a day, 2 days, 3 days for the health department, and I quarantine those 2 or 3 days, those are 2 or 3 days I'm not spreading the virus.
That's right. That's right.
Perhaps to the rest of my family. That's who you're most likely to infect is your family. So my family is important to me. So if you tell me, I'm going to say thank you,
right,
and I'm going to quarantine myself so I don't give it to my wife.
That's right.
Yeah.
And I'm going to talk to my wife. I'm going to talk to my kids. I'm going to say, hey, I was exposed at work. I was exposed somewhere. This coworker is now positive. Let me tell you, here's what I'm doing. And now my family may say, okay, good. I'm going to respect your quarantine. So there's just, communication is so key to all this. And sometimes we try to hide it, and that doesn't help.
Right. Great. International Civil Aviation Organization expect to offer guidelines that include screening with a test that has a sensitivity specificity of 95% to avoid false results. What tests would do that?
Well, we've got a lot of rapid tests that are coming out now, and one of the problems is that when you say that, well, there's two things really. One is that when you say that the sensitivity is 95%, well, that's still, you know, even if you go by that, and I'm suspicious because those sensitivities are being determined by the manufacturer right now. They've not, because they're coming out of these emergency use authorizations, which means those have not been verified by independent labs. And so there's an inherent desire on the part of the manufacturer to have a really good number there, right? So I'm not going to say they're lying, but I would like for it to be verified. But the point is that we need to recognize that there's still false negatives, and they may be larger than just 5%.
And the other thing that you wanted, you know, that you may want to just at least, or I should mention that you've said to me even this week, is that what's listed sometimes by the manufacturer is not what actually plays out when you do independent looks at those numbers. And that's why it's really critical that we continue to watch what's happening in the field and not just by what the manufacturer is saying.
Okay, testing. MIT reports an artificial intelligence cough detector that diagnoses if someone has COVID. They use a forced cough over a cell phone to match other recordings. That sounds quick and accurate as an indicator before any symptoms show. Have you heard how close they are to widespread use?
Yeah. So I've heard about this. In fact, one of our colleagues sent us an article about it, and I read up on it, and it sounds pretty interesting. Again, hasn't been validated by anybody else yet. And then the whole thing is that this is the laboratory setting where they've determined this. So making this something that's going to be commercially available, that's a whole bunch of other steps that have not started yet. But this is interesting.
How is the positivity rate looking? Should we be looking at 7-day or 14-day rates to understand the numbers?
So we've been using 14 days at both health departments, and the positivity, unfortunately, this is the test positivity, the percentage of those tests that are coming back positive with COVID-19, that has been inching up. And we had south of 6%, and now it's at 7%, and actually last I saw this week was 8.1%. So we're right at that number where it's inched up. And so this means that we all have to do our part, wear the mask, wash your hands, watch your distance, and get tested.
Okay. Thank you for joining us with COVID-19 Talks with Local Health Authorities. We'll be right back.
You're the engine that makes all things go, and you're always in disguise, my hero. I see your light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. Honest and selfless, I don't know if this helps it, but good job, you're doing a good job, a good job, good job, you're doing a good job. Don't get too down, the world needs you now. Know that you matter, 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 yeah.
Do you remember our first group photo? This is it. Smiles all around, even though we were all nervous.
Who could have imagined that our first weekend together would soon turn into a lifetime of memories?
You're an amazing young man. Your brothers and sisters really look up to you. They're a big brother.
It's so cool to watch the adult that you've become, and you really have done as much for us as you think we've done for you.
You know, it took 20 years, and I got my third child, who was 17 at the time.
There's so many rewards in life. You coming into our home was one of the greatest rewards we could have ever had.
I ain't never felt so much love before in my life.
Welcome back to COVID-19 Talk with Local Health Authorities. David, I think you wanted to add an additional comment to the positivity rate question.
Yeah, so the other part of that question was, should we be looking at 7-day or 14-day rolling averages? And the reason that we look at multiple day rolling averages is it takes the spiky volatility out of the reporting. And so whether it's 7 days or 14 days probably doesn't make a huge difference. The point is that you're now starting to see, you can see what the trend is and where things are going. That's the most important point, because we've said right along, there's no one metric, no one value in that metric. It's which way are things going. And so to your point, is things are slowly creeping up, which means we need to do a better job as a community.
That's right.
Houston ISD is in the statewide rapid testing participation program. What is the benefit?
So what I said yesterday was, anytime we have more testing in the community, that's a good thing, right? Now, the challenge with this, not just with HISD, but all the ISDs across the state, is that they're being given tests, one for each faculty member and 5% of the student body per month. So if you've got a school with, just to make round figures, you've got a school with 2,800 students, and it's a 28-to-1 ratio, and you've got 100 faculty member. So that means you're going to get 100 tests for the faculty members and 5% of the student body. So that's 140. So that's 240 tests per month for a population of 2,900 people. So how do you best use? That's a tiny amount of, and so that's the challenge. And this is one of the things that we're working with schools with right now to try and give them some guidance on how to most effectively use it.
Yeah.
Many believe a vaccine would have been approved by the end of October. Any news?
Well, actually, let me go back to the premise there. I'm not sure many believed it. I think some said it, and most were thinking that it was going to be pretty hard to have that happen. What we're hearing is that it is likely going to be sometime December, but I think we should really be thinking about the beginning part of 21, January, February, when we're really going to have doses that's going to really be available. However, a lot of this is really just the moving timeline with phase 3 trials, safety, making sure that it's effective, and all that is what's being worked on. We would rather that it is safe, effective, and that's all worked out before something goes out to the public.
Hey, can I add? I think it's an important point for the viewers. So, when the vaccine comes out, it's going to come out in the beginning in very small amounts, right? The manufacturers have to ramp up manufacturing. So it's going to come out in very small amounts. And my fear is that we're going to have a lot of people saying, I need to get it for this reason. And there's going to be a lot of scrambling and arguing about why they should. Of course, there's going to be another whole bunch of people who say, I'm not going to get it till whatever, right? But those who want it are going to be kind of fighting over it. And I think that people need to keep in mind that today we don't have a vaccine, but we still have the ability and the power to slow down the virus. So when the vaccine comes, it's just an extra added thing. It's not the end of the game. And in addition, when the vaccine comes out, we really need to get to 70–80% of the population to be immune, whether by previous infection or vaccine, and vaccine being current. It's going to be a long time before we're done wearing masks and social distancing. So I would just, for everybody who's going to be, anxious to get a vaccine in January, I would just relax a little bit.
Right. That's right.
Okay, the next one. Dr. Persse, please elaborate on your announcement about free at-home antibody testing.
Yeah, so that's a program that we've got. It's through the Area Agency on Aging, which covers both the city and the county. And now this is not just for anybody who wants it for convenience. You need to have a good reason why you can't go to a test site. And like I said, it's the Area Agency on Aging, and I believe their number is 832-393-4301.
Exactly. I wrote it down to make sure you got it right.
David,
so I win. Pass the test.
You won. I wrote it down to make sure Persse got it right.
David, the question is about antibody testing. Is that what the area agency, is it antibody or PCR?
No. It's a PCR.
It's a PCR test.
I think they asked about it. They said antibody.
No, it's a PCR test.
Actually, that threw me off a little bit too, but it's a PCR test.
Oh, good catch. Good pick.
David had the number, 832-393-4301. There you go.
Yeah, and the other thing I'd just say is that we also at the county have testing at home. If we get contacted by an individual who can't go to a test site for a medical reason or some other reason, then we can also send people to get in a limited, like we don't have as much, but in a limited basis to their home as well. And we've done that. So I think this is really the recognition of just how important testing is, and we want to do everything we can to remove any barriers to testing.
Right.
My grandkids love to play in a park located next to a school that is open after hours and on the weekend. What are sanitizing rules for park, as I've never seen anyone cleaning?
I don't know if there are sanitizing rules for parks.
Yeah, I was just thinking back to the reopening guidance that the Department of State Health Services at the state level had given, and there were some guidance that they had given to parks and recreation to do certain regular sanitizing things. Honestly, I don't know how much enforcement there has been in that, and I'm not sure how much it's being done. So here, let me give an example now. So that's one process, like what's formally done by the Parks and Rec folks, whatever the park is, private, public, whatever. I'll tell you what we're doing as a family is we're talking to our kids and we're saying we're not going to take you to a park unless we're with you, or we're going to take you, we're watching what you're doing, we're taking hand sanitizer with us, we're making sure that we're using it in a regular copious amount with our kids, and honestly we're doing everything we can as parents to watch what our kids are doing. So I would just suggest that you take some individual action as well when you're going into any public place where you think there may be risk for transmission.
Yeah. I think it's really good advice. I just also reinforce or underscore, the risk in the park really isn't the swing set. I mean, there's some, right? But the risk is the kids, talking and laughing and not having masks on and being too close for too long. That's the risk.
If you're in your social bubble, it's one thing. If you're not in the social bubble, there are other kids come, put those masks on, make sure you police that that's one of those, you've got to enforce it with your kids. Those masks have to be on.
How are we doing with the flu season? Dr. Fauci said it might be milder this year.
Yeah, well, it's awful early, but so far so good.
So far so good locally and regionally and statewide, and generally our flu season usually starts a little bit later, extends a little bit longer because of just our weather patterns. But I will say that what we've been seeing is that because of the wearing of masks and all these other modalities against COVID-19, we're hopeful, fingers crossed, that it helps us with flu measures, and we have mild season. We do not want to have a severe flu and COVID third wave on top of it. We would love this to be a low or less than busy season, and then we're just dealing with COVID.
And there's another thing we can do today to help protect ourselves. If people go out and get their flu shot today, the incidence of flu in the community will be much less. And not only that, but then if you become ill and you go to your practitioner and you let them know that you got the flu shot, it's going to help them more quickly make the right diagnosis.
That's right. That's right.
New York Times article said we really do not know where the virus is spreading. Is that true? What is the fix?
Well, I don't know what they meant by that specifically, but we do seem to know that it's spreading more amongst younger people. Again, it's this 18 to 30 year age group. It seems to be where we're seeing most of the spread now.
Yeah, I was just going to add on that. I think the article was referring to that a lot of people, when you go and talk to them about where did you get COVID-19, there's confusion because a lot of people don't know, because this is why limiting your interactions helps, or keeping track of who you've been around, that helps as well. Yeah.
Okay, October 12th was the Canadian Thanksgiving. If we look at the national spike in COVID after family gatherings, can we assume this will be our problem soon if we make the same mistake? Did the cases actually go up after October 12th in Canada, or do we know?
Yeah, I didn't look at the Canadian data. We'll have to look at it. But
yeah,
if they saw a spike and the timeline is right, then so the answer is yes. If Thanksgiving is Thanksgiving, we don't do what we're supposed to do, then yeah. I mean, there shouldn't be no mystery there.
Yeah, right.
Okay, thank you for joining us for COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Welcome back to COVID-19 Talk with local health authorities. Taste and smell. Let's try to read this fast. A study in the UK showed there was a highly specific symptom like loss of smell that had a higher positive rate than just loss of taste. What are local doctors seeing? This is a three-part question. Do we know?
Yeah, so I think I had talked maybe a few weeks ago that I had one of my really good colleagues is Dr. Reza Pasha, who is an ENT physician here, a surgeon here, and he said very much that they've been watching what's been happening around this loss of taste and loss of smell. And loss of smell is such an important piece that if he sees that, that really is where his alarm bells go up higher, that this is something to really be concerned about. It's not that loss of taste can't be. I think the loss of taste and smell, the reason they're so important is that they usually don't happen in a lot of conditions. And so when you have a cough or you have shortness of breath, you have a fever, it could be a lot of other things. And that's why folks are focusing on this as well.
Second part, a pilot study says that 5 odors, peppermint, fennel, coconut oil, garlic, and cardamom were a swift odor test to see if you lost a sense of smell. Is loss of smell only partial, or is it lost just to specific odors? And then the second part of that is describe loss of taste as changed taste, not really a loss. What is the official indicator?
I don't think there's an official, my understanding is that it can, for some people, be partial loss, and for others it can be a complete loss. So even partial change from your usual baseline, that's what you're looking for. Now, as far as the other, cardamom, honestly, I don't know enough about that.
I don't know.
You don't know? Okay, let's move on. 2/3 of middle-aged people with COVID are men, but it appears the toll on job loss and other pressures is greater for women. Why are men being hit harder?
Well, it could be the other way too. Why are women also being hit? I think everybody's getting hit hard pretty. It depends on.
Yeah, I have noticed, even in some of our data in certain categories, that there's I think men are getting hospitalized more than I think in our testing. It's a little bit over 50% of men are testing positive, but in terms of hospitalization, I think it was higher. That caught my attention in some of our own internal data. I don't have a good reason for it.
Yeah, I just hope that men also remember that wearing a mask is important, and all those things that you're not immune. You've got to do the 3 W's. If you don't do those 3 W's, whether you're a man, a woman, a child, or a senior, whether you have a chronic health condition or not, you are at risk for COVID-19.
Dr. Burke says we're entering the worst stage of the virus. Do you agree?
So, yeah, I saw that. I don't know when you say the stage of the virus. Certainly with it being winter and it being viral season, if we have another big wave now, it could be more challenging because our behaviors change, which facilitate viral spread. We're spending more time indoors, family gatherings, all those sorts of things. That's going to facilitate viral spread. The virus hasn't changed, so it's just the higher risk of more people getting sick. Now, the other thing is that it's being this time of year when there are other viruses that are going around. I fear that we're going to have an increased chance of people saying, "Oh, well, it's just a cold, or it's just a this, or just that," and therefore they won't get tested. Meanwhile, they continue spreading it, and I think that's what my concern is.
Yeah, I guess what I would say is that pandemics tend to come in waves, and we successfully fought the first wave in March, April, then we fought the second really bad wave in June, July. In our community, we're in the 3rd wave, and this is just the waves that are going to be coming. And even when we have vaccine, we're still going to have additional waves until we get past this. So just cannot let our guard down. And some of that, what Dr. Burks is saying, is really dependent on us.
Can I point out something? The reason we have waves, and every wave you got your increase, and you always get your decrease. The reason we have the decrease making it a wave is that people change their behaviors.
That's right.
They say, "Oh my God, this is real. This is bad. I got to change my behavior."
That's right.
So if we were to do that on the front side of the wave,
we wouldn't have a wave.
We wouldn't have a wave.
We'd have a ripple.
Coldest and hottest areas of the country are the first to increase transmission because people go inside. We usually look at Australia to see what the next flu season will look like. They went through their winter with low COVID numbers, but some areas there have been in lockdown. Do we have any chance of mandated lockdown for business and schools in our city or county?
Look, I don't think you can say never for anything in this pandemic. This has broken every rule that we ever thought. I don't think we can ever say never, but I will say that, you know, folks are really, including officials, are really hopeful that we never get to the point where that is the question on the table, that there are all these other behaviors that we do so that we don't have these big spikes and we can actually fight this. And we can, as a community, do that. We've done it twice successfully as a community. And let's make sure we don't ever get to that question.
Are stomach pains a sign of COVID? That was the only symptom my young school-age neighbor had and was positive.
Well, certainly the virus does infiltrate the GI tract and cause problems. In fact, one of the, early on, one of the big things that surprised people about this virus was that many people, their only symptoms were nausea, vomiting, diarrhea, and abdominal cramps. So one thing about this virus is that it's kind of hard to find the organ system that this virus doesn't impact. Right? We've got skin changes, we've got nasal, we got smell and taste, we got pulmonary, we got cardiac, we got intestinal. But yeah, so sometimes, and everybody's different, but sure, just stomach cramps alone, absolutely could be.
What are sure signs of already having had COVID? I've heard rashes, thyroid, heart rhythm problems, jaw pain, and low temperature fever could be indicators.
I think the sure sign would be actually laboratory testing. I think it would be antibody. It would be the right kind of antibody, and that would tell, and that's where you have to talk to your doctor and you have to really understand from that healthcare provider what an antibody test really means. Other signs, honestly, physically, it's hard to know if it's something else or if it's COVID.
Right, and so I think the person with that question is pointing out the fact that we have people who have these prolonged symptoms, right, for weeks on end. Some people have headaches and myalgias and rashes and all those other things. So we do have this phenomenon of people having lung, but there's nothing specific about it. Again, going back to the fact that this virus attacks nearly every organ system.
Okay, a Russian doctor purposely reinfected himself, and the story suggests the second case was worse.
Well, if he reinfected himself and he did so with a large amount of viral load, then that wouldn't surprise me in the least. A lot of how sick you get depends on how much virus you got infected with the first time.
That's right, and we do know reinfection is possible.
And y'all are not really planning on doing that, are you?
That is not.
I'm
not.
Okay, in 1 minute. T cells are back in the news. The study shows that white blood cell levels are higher in people who have symptoms. What does this mean regarding immunity? Does that indicate a booster shot is required?
All right, so that's a confusing question. But one thing is, when you have an infection, you expect your white blood cell count to go up. That's your immune system responding to the infection, creates a larger army of white blood cells. So, that's totally expected. Yeah. And there are different kinds of white blood cells. There's T cells, there's B cells. Then within the T's and B's, there's all kinds of different cells. So I don't exactly know how to best answer that question.
Right. And the only thing I would add, Stephen, is that, look, we're going through a very difficult time in our country with election season. Obviously, we're still working through and figuring out who's going to be our president next. Regardless of what that outcome is, it is so critical that we continue to remember the importance of fighting COVID-19. And so I just wanted to say thank you to our community. Thank you to you both for your leadership. And I just want to say that how important it is for us to continue our fight, because this is going to go on for months and months and months.
We'll continue this journey. Thank you for joining us with COVID-19 Talk with local health authorities. Dr. David Persse, representing the City of Houston. Dr. Umair Shah, representing Harris County. Thank you to the Rotary Club of Houston for sponsoring this, and past President Kathy Finninger for providing us with these questions. My name is Stephen Williams, Director of the Houston Health Department.